Okay, good morning. So I'm here to perform an esophageal suctioning. So first and foremost is we have to check the patient's chart, make sure we get any important information such as if the patient might be bleeding or etc. And then after that, we go inside to the patient's room, make sure we introduce ourselves if there are healthcare staff present or even relatives, and then explain to them what we're going to do. And then make sure we also have to check the patient's ID band to ensure they are the correct patient. So first things first is we have to make sure we do our patient assessment, obtain vital signs, and then make sure we position the patient comfortably. And then once we're done, we're gonna set everything, the supplies in here, such as the catheter if it is present, everything is complete. And then we have here the sterile gloves, make sure it is fully open and then not able to touch anything else. And then we have here a lubricating jelly, and then the lubricating jelly we can put it in here, the cover of the basin, or if possible we have a clean gauze. And then make sure we pour adequate amount of sterile water to the catheter. And then after that, we're going to wear appropriate PPE such as these clean gloves in here. And then if possible, we can also wear a gown, a face shield, and even for our hair to prevent from any exposure such as splashing of fluids or blood. So in here we also have a nasopharyngeal airway. With this one, we will know with its size if we measure it from the tip of the nose until the earlobe, or we can measure it or check it with this hole in here to make sure that it's just if it is too small or too big for the patient. And then before inserting this one, make sure we lubricate it with a lubricating jelly in order for us to insert it with ease. And then carefully insert it to the patient's nose, but before that we inspect at all times both nostrils if there are any deviated septum. So assuming we're going to put it to this patient's nose gently, and then if we sense first any restriction, first thing to do is we have to gently twist it until if such worst scenarios such as if there is still continue of resistance, the best thing to do is we have to remove it, and then we have to put it on a different on the other nostril, or we either have to replace it with a new nasopharyngeal airway. So once being placed, make sure we hook it up with a non-rebreather mask, set adequate flow, and then make sure we inspect it if the bag would fully inflate. So assuming the bag's fully inflated, place it on top of the patient in order for them to hyperoxygenate before doing the suctioning. And then in here we have the regulator. With the regulator we can set the pressure at about -120 to -150, and then make sure that the tubing is no longer kink or no obstructions present. And then by knowing this one, we also have to check the bottle if there are any cracks or if there are any misconnections or leaks. And then we also have to obstruct it with our fingers, with our thumb, to know if what's the pressure that this regulator would able to reach to. So we also have to just twist it if we want to adjust the pressure if it's just too high, especially it reaches more than -150. And then once we're done, we have to put it in here, and then we have to wear the sterile gloves. And then another thing, with the nasopharyngeal airway, once we place it to the patient, we can also know with its appropriate area where it's being put up by having also a tongue depressor, so that we will know by checking it if it's being put it to the exact place to the patient's airway. So after that, we have to choose which one is our dominant hand, such as knowing which will be our sterile. So this one will be my clean hand, this one will be my sterile. So with this, I'm gonna hook it with a catheter. We will know with its hissing sound and then try to obstruct it if it's functioning. And then we can also have to make sure we lubricate or try to suck adequate amount of sterile water in here, and then we will know if it's able to suck adequate amount with this tubing. And then once